Hello, my name is Luz Garcia-Pennock, and I'm a student at Rhombus University for Master's in Counseling Psychology. And this is an assignment in which we are going to engage in intensive outpatient program. And within this program, there's going to be a group session, psychotherapy session, with 3 participants, and then myself being the psychotherapist. The setting is intensive outpatient program at a mental health counseling center, telehealth for adults. Okay. And the cast is myself, the therapist. My name is Leitch. We have 3 participants: May, talkative, reflective, and comfortable sharing. Participant 2, Juan, talkative, asks questions, engages readily. Participant 3, Christy, quiet, observant, participates minimally, but is present and attentive. So I'll provide a little bit feedback before we dive in. Before we begin the session, I want to identify the technique and theoretical orientation for this demonstration. Today, I'll be facilitating a trauma-informed psychoeducation group using the following technique: the window of tolerance framework, originally developed by Dr. Dan Siegel. The concept is foundational to several trauma-informed approaches, including sensor-motor psychotherapy and somatic experience. The technique I'm demonstrating is psychoeducation within a group format, which involves teaching clients about nervous system regulation, specifically the concepts of hyperarousal and hypoarousal, while incorporating a brief grounding exercise to model regulation skills in session. The theoretical orientation is trauma-informed care, which focuses on safety, choice, collaboration, in understanding trauma responses as adaptive rather than pathological. I'll now begin the mock session with the 3 group that are also mock members. This is not an actual therapy session. We will begin now. I'll begin with the introduction and the welcome. Hi, everyone. Welcome. My name is Leitch, and I'll be facilitating our group today. Thank you for showing up today. I know carving out time in the middle of the week isn't always easy. So thank you so much. Before we dive in, let's do a quick round of names, just names, so we're oriented to one another. And so my name is Leitch, and next goes May, and then so forth.
Hi, I'm May.
Juan. Hi, everyone.
Christy.
Thank you all for sharing your names. Great, thank you. Today we're going to spend time together talking about something called the window of tolerance. It's a concept that shows up a lot in trauma-informed care. And honestly, it's something that applies to pretty much everyone, each of us, whether or not you'd call it your experience as trauma with a capital T, and that's the topic that we discussed last week. So before we start talking about our topic and going into detail and learning and engaging, we have the following ground rules. Let's go over a few ground rules so we feel safe, and it's a safe space for all of us and each of us. Part of what we're building here is what some trauma-informed models call a resilient zone. Like, in a sense, you're in your zone. A shared sense of steadiness in a room that we each track and return to. It's like, what I call it is when we are, in a sense, feeling within peace in our zone. Like, I would also add a little bit, that I wasn't planning to share, but I know a couple of students shared before in another class. It's the time before I lose my maybe cool or so while we're still calm. So I'm going to go over the ground rules. Confidentiality, what we talk about here stays here. One voice at a time. We'll do our best to let each person finish their thought. Participation is invited, never forced. If you want to just listen today, that's completely okay. You can pass at any point. This is psychoeducation, not a deep processing space. You do that more in individual psychotherapy. We're here to learn a framework together, not to unpack anyone's individual story in detail today. Does that feel okay to everyone? With that being said, any questions before we continue?
No, that makes sense.
Sounds good.
Okay.
Okay. And I just wanted to make sure that if you can speak just a little bit louder, each of you. I have a little bit of a hearing problem, and that's why. So I really appreciate your help. So we're going to go into grounding and an introduction exercise. Let's start with something quick that helps us arrive in the room together. I want you to take one slow breath and start with the posture. Take one slow breath through your nose for a count of 4. And then exhale through your mouth. And then let's do another one together. Now, just briefly, in one word, how's your body feeling right now? Doesn't have to be deep, just one word.
Tired.
A little anxious, actually.
Okay, I guess. Calm.
Thank you all for sharing that. Notice we all gave pretty different answers: tired, anxious, calm. And that's actually a perfect bridge into what we're talking about today. Understanding the window of tolerance. So, the window of tolerance is a concept developed, as I shared, by Dr. Dan Siegel to describe the optimal zone of arousal where a person can think clearly, feel their emotions without drowning in them, and stay present with what's happening around us. But when something pushes you outside of that window, you go in one or two directions. One can be hyperarousal. That's your fight or flight response. Racing heart, feeling keyed up, anxious, maybe irritable, hypervigilant, or panicky with tight muscles. The other opposite, that's more of a shutdown or a freeze response. It's hyperarousal. That's more of a shutdown or freeze response, numbness, emptiness, a blank or flat feeling, low energy, disconnected.
Okay, that makes a lot of sense with what I said earlier, the anxious thing. Is that the hyperarousal side?
Exactly. Yes. What you named earlier is a great real time example.
So when you said tired a minute ago, wait, that was me. I said tired is that the shutdown one or the hypoarousal side?
Good question. Great insight. It could be, yes, tired can sometimes be a milder version of that hypoarousal state, especially if it comes with feeling checked out or hard to focus. It's not automatic, but it's worth noticing. Here's the important part. Neither of these states is a character flaw or a sign that something is wrong with you or with myself, with any of us. Your nervous system is doing exactly what it learned to do, often a long time ago, to keep us safe. The narrowing of a person's window after difficult experiences isn't pathology or illness. It's the nervous system intelligence adaptation to an environment where safety was not reliable. And I'll add a little bit more to that. It's a way in which our body says you're not safe to be yourself in a sense. For example, it's happening before we react to something or we emotionally check out. I originally wasn't planning to add that insight, but I thought it was more real insight that I needed to add.
Does everyone's window look the same?
Huh. Great question. Really good question, Christy. No, everyone's window is a different size. And it can even change day to day depending on stress, sleep, or how supported you feel. That's actually one reason group spaces like this can help. Being around others who are working on similar things can widen your own sense of what's manageable.
That's kind of a relief to hear, honestly. I always thought if I got triggered or shut down, that it meant I was doing something wrong.
That's such a common relief, May, uh, that you can share that, right? And that's such a common belief. And it's one we want to gently challenge here. This isn't about willpower. You can't just think your way out of a nervous system response. It's a body-based process.
What do you actually do when you notice you're outside of that window?
Oh, great segue. The first step is noticing, naming where you are, like we did a minute ago, or even rating it in a scale from 0 to 10 so you can track it over time. Once you notice, some small tools can help bring you back. Slow breathing, or noticing your feet on the floor, or your contact with the chair. Naming a few things you can see in detail. The last one, describing something in the room, can help anchor back into the present moment in your connection with the people around you. We don't have time to practice all those today, but that breath we did at the start is one simple example.
I liked the breathing one.
I'm really glad to hear that, Christy. Thank you for saying so. One last thing I want to name. This isn't an emotional concept. It shows up in the body too. Even in the fields like physiotherapy, practitioners are trained to notice when a patient is drifting into hyperarousal or hyperarousal during a session, and to adjust their own tone, pace, and touch to help guide the patient into a workable zone. A calmer voice and a slower pace for someone who's activated, or a steady grounding cue, like noticing contact with the floor for someone who's shut down. It's a good reminder that widening this window, the zone, isn't just about insight. It's about something we practice within our bodies in relationship with other people over and over. So we will go into a recap. Everyone, let's bring it together. Together, we talked about the window of tolerance, the zone where we can think clearly and respond flexibly. And the two directions we move outside of it, hyperarousal or hypoarousal, hyperarousal or hypoarousal. We also practice one small tool, the slow breathe, that can help bring us back toward center. May, Juan, Christy, is there one thing from today you're taking with you? Even just one word or phrase?
Probably it's not a character flaw. I'm going to sit with that one.
For me, just having a name for it, hyperarousal, makes it feel less scary somehow.
The breathing thing.
Thank you all for that. Those are three really different ways, and that's exactly how it's supposed to work. Everyone finds their own entry point. And with that, we will close the group. I will finish with sharing a statement for all of us. I want to thank each of you for being present and open today, including Christy. Your quiet attention matters just as much as the talking of each of us. Each of you matter. Juan, May, I love the unique perspectives in your experiences that you brought and how you process that information. I love that you each participated in your own unique ways. And this is also how we learn from one another, because we learn how others experience this. And one thing I wanted to make sure that we take with us, that this is a skill that we build over time, not something that clicks into place after one session. So be patient with ourselves this week and every day. I do look forward to seeing you guys next week. Next week, we're going to continue working, and we're actually going to be talking about how music and art can help us engage in our own therapeutic journey. So that brings us to time. Thank you all again, and I will see you next session next week.
Thanks, Light.
Thank you.
Bye.
This concludes the group session, and I will stop recording